The following segment is sponsored by Northern Nevada Health System.
Welcome back to Family 411. We are here with Shelby Hunt, the Director of Emergency Services here at Northern Nevada Medical Center. And today we're talking about easing child anxiety when it comes to take your kid to a medical facility, because that can be really scary for a lot of kids.
It can be really, really scary. We know, the National Institute of Mental Health says 1 in 5 children have some type of an anxiety that they will grow out of in their adolescent years, but it definitely is a concern for many, many parents.
So what can you do to try to ease their fears and I guess make it as comfortable for them as possible?
What we recommend is, the biggest piece is we all need to stay calm. As a child gets, very anxious or frustrated or tearful, and they're scared. They feel helpless. They don't know what's going to happen. So having all of the adults around them, whether you're a healthcare professional or their parents, staying as calm as possible and not feeding into that anxiety is the number one piece that we need to remember.
Sounds simple enough. What strategies do medical professionals use if they notice that a child is getting a little anxious?
Sure. Again, same thing. We need to remain calm in that stressful situation. We do take classes and education on different aspects of how to talk with children. However, probably the other piece to remember is, getting on their level. Having a large adult who you don't know stand over you is very stressful. So sitting side by side or sitting on the bed with them or even getting lower so they're actually in a taller position helps significantly. Also, if you're going to be doing a procedure, bring out the supplies. Let them see, touch, and feel what is actually going to be happening to them, and they can even make choices. Do you want a red bandage or a blue bandage? Give them some sort of empowerment in that situation. We also really try to watch words. Not many kids know what sutures are. That can sound really, really scary, or stitches, but yet you can say string band-aids. We all know what string is. That's not so scary. Band-aids, everybody loves. You put the two together.
Any other advice for parents of pediatric patients?
If you're coming to the hospital, bring comfort things. Do they have a blanket? Do they have a favorite stuffed animal? Bring toys. We all try to keep coloring books and things like that around to keep them busy. But any of those comfort, reassuring things that they love, their Snuggies, bring those with you as much as possible. If you have any concerns about them having anxiety issues, then, talk to your pediatrician. There's a lot out there on the websites that you can look at also, but including the pediatricians, their school counselors is a place to start.
All right, great. Shelby, thank you so much. If you want to watch this again, check it out on our website, foxreno.com.